for being here today. As you just heard from Dr. Birx today, we have held a roundtable discussions with Dr. Birx, the cabinet members, and some of the community stakeholders to discuss the COVID-19. It's an honor and privilege for Dr. Birx to be here today to give us some information on the national level, to show where Missouri is trending on that stage. But I want to thank her personally, for her, the administration, the president, the vice president, for what they've done for this country and what they continue to do for this country, dealing with the coronavirus across the country, and also to take the time to be here in Missouri to help us with guidelines, to give us that we're all working together. And I think one of the things that you realize from, you don't have to spend very much time with Dr. Birx, and realize her agenda is about taking care of the American people and taking care of Missouri, which I'm proud of. And I appreciate the president and the vice president for everything they're doing. So with that, again, it's an honor for Dr. Birx to be here today, and I want to turn it over to Dr. Birx a little bit. Dr. Birx?
Great, thank you, Governor. What a privilege to be here in Missouri. Spent the last 2 days driving around the highways and byways of Missouri. We find that that is really critical to really experience how Missourians are living with COVID and really understand that. We've been to Branson, we went to the Lake of the Ozarks on the way up here at 5:30 this morning, and we really had great conversations with the governors, his cabinet staff, and with community experts, and it's been a privilege to be here. I think many of you know that post-Labor Day, post-Memorial Day, there was a significant outbreak across the South, and different from the outbreak in March and April, and that's why it's really important that Missourians understand that. The outbreak in March and April was very large metros in the United States, from Detroit to Chicago to Boston to New York to Philadelphia to Baltimore to Washington, D.C. This particular outbreak that began after Memorial Day was really a reflection of Americans moving into summer and traveling around the country. And so across the South and up the West Coast, from Washington down to California, from Arizona, across to Florida, up to Georgia and South Carolina, we saw a diffuse spread of the virus. First among asymptomatic young people primarily, and that's why it was only visible by increasing what we call test positivity. The ability to really see that the number of people in that particular state or county had an increased test positivity. We've been working across the South. This was my 20th state to be in. 8 weeks ago, we began publishing what we call the Governor's Report. These are reports directly to the governors every week for the last 8 weeks, and obviously we still continue to have the vice president or the president's led calls with each of the governors every single week. But the president and vice president wanted me to go out state by state and really meet with communities and leading officials, mayors, and governors to really understand what was happening in their state and understand how to improve mitigation against this virus. This box-in strategy that has been being used here in Missouri, I think really is an important example of how to really protect the vulnerable individuals. When you see how Missouri has done with their long-term care facilities, when you see what they've done with the VA care facilities, it's really an important, critical message. In Arkansas, we saw a really incredible practice on a COVID booklet for parents and children going back to school, to really inform the children and families about what COVID-19 is, and really bring that family up to a knowledge of how important masks are, how important social distancing is. And I think my fundamental message to everyone in Missouri is we have a habit of looking at an institution where there's a test positive case, and we don't look back and say that case came from the community. And so all of us across Missouri, whether you're in Kansas City or St. Louis, whether you're in Springfield, Joplin, or Jefferson City, whether you're in Branson or at the Lake of the Ozarks, our job in each and every community is to decrease viral spread and a clear pathway forward together to control this virus. What does that mean? We need every American and everybody in Missouri to be wearing a mask and socially distancing. What does social distancing mean? It means that we're asking every citizen to not have large gatherings in their backyards until we have an effective vaccine, to really curtail Those gatherings when you bring people together, because we know there's amazing asymptomatic spread. And throughout the South, we have seen in rural areas and in urban areas, which are equally impacted by this virus. Remember, in Alabama and Mississippi and the parishes of Louisiana, over 95% of the counties are impacted. That is not the same in Missouri. You have some counties here with very low case numbers. You have counties with under 5% test positivity. Every person needs to really ensure that they're not infecting another, and that means we can't have these large parties because of the level of asymptomatic spread. I know we all want to believe our family members or our neighbors couldn't possibly have COVID. I can tell you across the United States that they do, and it doesn't matter if you're in a rural area or an urban area, they do, they don't know they're infected, and they're spreading the virus to others. We've seen parties in Texas where 150 out of 150 people were infected, an outdoor party. So this is what we need to do together, because together if we decrease community spread in this common sense pathway forward, we can have the schools open, we can have the universities and colleges open, we can have the sports teams, but we all have to do our part to get these cases down no matter where you live in the United States. So I will stop there and take your questions, but I just want to conclude by, again, thanking the governors and the governor's staff for the really privilege to be here, to hear from them, to learn from them, and to take these ideas back onto our governor's call that is just a few hours from now. So thank you.
Yeah, you can go.
Yes, good morning, Dr. Birx. Thanks for coming today. I'm kind of hiding back here behind these cameras.
I see you.
I know Missouri was one of the last states to shut down and one of the first to open back up again, and there is no statewide mask mandate. The governor has said part of the reason is our population diversity, I guess, with ultra-urban and very rural areas, and so one size doesn't fit all. What is your message to the governor here and to all of us, I guess, as far as how we've been doing?
Well, what I've learned across this country is every governor and every mayor is fiercely protective of their citizens. And what I've learned from this governor is that really the fact that Missouri has different, we drove through towns across the mountains that had 157 people who lived there. And so getting a message to them to really understand how to protect one another is very key. But also understanding the unique situation of these isolated mountain communities and these isolated rural communities. What I discussed with the governor is what I think is an excellent example from Texas, who had similar, very rural areas that were not impacted as greatly as some of the more urban areas. And small metro areas, which I just described about Joplin, Jefferson City, and Springfield. And what the governor of Texas did is in any county that has more than 20 cases, had a mask mandate to really make it clear that you're following the data. And I want to really reassure everyone from Missouri, the data that was presented today by the group led by the governor is identical to the data that we have. And I think that's really critically important, is they're on top of their data, they know where this virus is, they know where the virus isn't, and they know what they're doing to stop the virus. And I think that was very reassuring. So we discussed what some of the other governors and states are doing that are in similar situations. Now in states like Mississippi, or states like Alabama, where 95+% of counties have active community spread, that's why they did a mask mandate. Missouri has less than half their counties in that situation. So again, every one of these messages have to be adjusted, but every community member in Missouri should know how to protect themselves from the virus.
Should Missouri have a mask mandate?
We discussed that specific issue related to Texas. You know, every public health official anywhere in the country will tell you it is easier to have a statewide mask mandate. But in this case, I think there was specific, if you can get 100% of the retailers to require masks, as we saw in Branson, and as we saw in some of the other smaller communities, it sends the message to the community that masks are important. And so we discussed that option about what Texas had done.